Thanks for joining us this week on the show. I have a special personal message for you this week. It's February. It is Heart Health Awareness Month. And today I'm sharing a story of an experience that myself and my husband had at the beginning of this year. So for your awareness, your heart health, and your education, I hope that you'll enjoy this episode. Thanks for tuning in. It's time to flip the script on stress and learn how to thrive today and throughout your days. Join me for inspiration and interviews with folks who are shining their light in the world in the areas of positive mindset, health, and well-being. I'm your host, Susi Vine. Let's get Happified. Welcome back. I am so happy to have you with me this week on the show for a special conversation that I would like to have just you and me. Well, and maybe anybody else that you feel is going to be supported with this exploration and the information that I'm sharing with you about the experience that myself and my husband went through at the beginning of this year. So first, let me start by saying happy February and happy Heart Health Awareness Month. It's the perfect time to be sharing this experience that is still pretty fresh, certainly for my husband who is still recovering and myself who was able to spend the time that I needed to with him and support him through his recovery. So this year, this Heart Health Awareness Month, we are celebrating his survival of an aortic aneurysm, a pretty shocking event that was not anything that either of us had planned. In fact, after some other health issues were resolved last year, we thought the recovery period was behind us, and we were looking forward to 2025 being back to business as usual. Well, as tends to happen, life is what happens when you're busy making plans. So we started the year with an experience that wasn't like anything either of us had ever been through, nor anyone in our immediate family. So I want to give you a little bit of an insight as to our story, because I think that there is important information there in terms of warning signs, things to be aware of. Even if you do not personally have cardiac disease, my husband does not. Still to this day, he wouldn't be classified as someone having cardiac disease. However, he has survived this experience through a lot of divine grace and timing and phenomenal care team here in San Diego. But I'll also share some insights about how stress can impact your cardiac health, navigating this kind of situation, how I tried to stay on top of and aware of the stress that both of us were experiencing, and some insights that might be beneficial to you and, as I suggested, someone that you love. I think this is an important story to share just because sometimes we tend to have our eye on the ball, right? Some of the major factors. Most of us are aware and might even be good about going in for screenings for cardiac health, for our metabolic panel, to make sure our cholesterol is in good shape, right? We're aware of some of these big players, and yet our body is an extraordinary array of systems that work together and influence each other. And when any of these come out of balance, it sets the stage for dis-ease to take root. It all started shortly after the new year. My husband, not to tell too many tales since he's not here to defend himself, just celebrated his 60th birthday. And shortly after the new year, after traveling and spending the holiday with my family in Oregon, we thought that he had come down with a virus. It made sense. We had travel, we had been flying, we had been proximity with family for an extended family celebration. And so when he started coughing and then had a fever, we thought, this sounds like something he picked up while he was traveling. RSV was certainly in the headlines, high levels of flu. And so He rested, he stayed in bed, we kept his fluids up, I was watching his temperature, I gave him space to heal and took some separate space so that I could stay well. What was really unique, however, about the cough that he developed, as it struck me immediately, was that he felt it was a very suffocative cough. He would cough and then he would be left gasping for air. But as I mentioned, he had a temperature which fit the profile of a virus. He felt tired. He wasn't comfortable laying down, but he found positions he was able to be comfortable in. And he kind of tried to power through for several days. I couldn't convince him to go to urgent care to see about getting an antiviral to try to limit the impacts of this, because I could tell it was a really significant bug, whatever had brought him down. He's generally a very high vitality, very healthy guy. Well, about 5 days in, I finally won out. He went down to urgent care, and a nurse was quite startled at the sound of a heart murmur and asked to confirm, well, you're aware you have a heart murmur? To which he replied, no, I absolutely don't. When I was having medical visits 2 months ago, no one has seen it. No one has ever recorded this. I absolutely do not. At which point they transferred him over to the hospital. We'll fast forward you through some of the details, but what turned out to be the case was a ruptured sova, a sinus of Valsalva aneurysm that had ruptured. And this particular type of aortic aneurysm ruptured into his heart. So it was captured, and the heart was doing the best that it could to maintain systems, to maintain business as usual. But the high pressure of the aorta was running into the lower pressure right side of the heart. And this caused pulmonary edema, as evidenced by the coughing and the suffocative cough. So, with some time, some questioning, some scans, absolutely no evidence of cardiac disease, maybe some unhealthy cholesterol that we will be addressing through diet and lifestyle, they started asking some other questions. Does your skin have high levels of elasticity? Are you double jointed? We started talking about some other situations that he had been having, and it seemed like he's checking the boxes for a connective tissue disorder, which is genetic and might explain this tendency for the aorta to have the separation and the ruptured aneurysm that was discovered. So some other curiosities that need to be pursued there, I'm just sharing that information to let you know that even though we tend to lump this all into cardiovascular health, heart disease, health, and wellness, sometimes the beauty of our intricately intertwined systems, one situation sets the table for another issue. When you're watching over here, your eye is on the ball for cardiac health. Is his heart healthy? And all signs point to yes. Sometimes there are other influences that we don't see coming that can have a huge impact. So I will say that fortunately, and with deep, deep gratitude to the cardiac care team at Scripps and the Prebys Cardiovascular Institute, Dan had open heart surgery and has recovered extraordinarily well because he is in typically such strong health and vitality. He has been at home trying his hardest to take it easy and not get back to business as usual quite yet, letting his body recover. So we have been, as I can't say often enough, we've been extraordinarily lucky. And I wanted to share this information to you for a number of different reasons. As I already mentioned, because stress has a direct correlation with the health of our cardiovascular system. Chronic stress is known to cause heart disease because of the impact of these emotions, these feelings of stress, the hormones of stress, cortisol and adrenaline, and the impact they have in our heart. That racing heart sensation is literally a higher physical load on our heart. And if we live in that level of chronic stress, we are keeping our heart under this higher demand. High blood pressure, heart disease, other specific manifestations arise from this effect of chronic stress. I have had a guest on my podcast previously, and I will share her show in the show notes. Audrey Weidman shared her story of a heart attack when she had zero evidence of cardiovascular disease. However, she had been subject to stress and the way that she handled stress in her life, and that's something that we explore in that conversation. So I will be linking that, of course, since it is so beautifully in line with our topic this week and this month, looking at the health of our heart. I want to share, too, how we made it through those weeks of not really knowing what was going on, of then knowing what we are facing and waiting for the big day to come, for making it through surgery and following that, for having a radical change in the lifestyle that my husband is used to enjoying. I was very lucky. As I already said, there was a lot of divine grace in this. I had planned to be traveling, and so I had the time off from work, so I didn't have to try to extricate myself out of a lot of prior commitments. Unfortunately, that vacation has been postponed, and I am looking forward to enjoying that soon. But that was a really big help, and perhaps not available to everyone, but I do want to remind people, it might take some time for the wheels to be in motion, for your situation to fill the requirements of FMLA, for family medical leave. And I hope that you are in a commitment, whether that is an occupation or your own business, where you can make that opportunity to take this time for yourself. I can't imagine how it would have been had I tried to maintain working and be present for my husband. Ultimately, while he was in the hospital, I was there typically on average about 12 hours a day. Stayed over the night before the surgery, and then when he was in surgery and in all the best possible hands, I actually took the day away from the hospital, spent that day with a friend who kept me company. I had the phone available. I had a couple of phone conversations with the nurse in the operating room, which was great for my peace of mind. And I wasn't sitting there in a chair doing damage to my back that isn't really made for chair sitting, certainly in that extent of time and under stress, and then through that recovery period. So there's a lot to be said for having a terrific medical team, for having doctors who hear your questions and give you all the answers that they can. My good luck to being able to be in the hospital room for the most part meant that I was able to listen in and hear these conversations between my husband and his doctors. And so I didn't have a lot of questions, and I wasn't putting him in that situation of trying to get answers to my questions when I wasn't able to be there. Right now, though, through the ability, through MyChart or whatever digital system you might have with your care providers, that certainly does make it a lot easier to relate questions to your team if you can't physically be in the room with them. So that's something that I hope people know about and know to take the fullest advantage of, this opportunity for communication with your medical care team. And so in addition to getting that time off and being able to be present where I felt that I was most needed, I also turned to my flower essences. If you've heard some of my episodes before, you know I'm a huge fan of the Bach flowers, and I certainly was relying on them. I was taking some essences like red chestnut to calm my concern for my husband. Rock rose is a beautiful flower essence for fright and shock. It's one of the essences that is in Rescue Remedy, a blend of 5 Bach flowers. For anybody who goes through any kind of this situation, if you have a trip to urgent care for any reason, if you have kids who are subject to accidents, I can't recommend strongly enough having a bottle of the Rescue Remedy drops or a little tin of their pastille candies nearby. It is such a great go-to, and it really calms the mental agitation, that terror, that fright, that reactiveness that comes with these kind of crisis situations. So I was grateful to have my flower essences, and as Dan was in the hospital, and they were trying to relieve the fluid load in his body. He was on diuretics and on limited fluid intake. I made for him a little mouth moistening spray. As I make my flower essence blends, I use vegetable glycerin as a preservative, which adds a little bit of sweetness, and was also a primary ingredient in the mouth moistening spray that they had available at the hospital, which he hated. He's very sensitive to tastes and to scents. And so I made his own proprietary combination, and I added flower essences to that. Also, again, the rock rose, rock water to help him relax and go with the flow, white chestnut to give him peace of mind, and some essences just to help him feel more relaxed and calm. And I'm very proud to say, I do believe he felt the benefit of it, and it was something that he asked for. Obviously, it had the benefit of giving him a little something to spray in the mouth to help him feel a little not so parched from the fluid restrictions, but also helping to calm his nerves in that hospital environment where you've got the alarms, the bells, the beeping, especially when you're in the cardiac care and ICU floors where there's a lot going on. It is hard to get your rest in the hospital. And so I think that being able to bring the flower essences in that capacity was a huge benefit. I also will say too, beyond grateful for our friends, and just as a word, if you know someone who's going through a situation like this or is in and out of hospitals, one of the greatest and most thoughtful gifts that some friends shared with us was DoorDash gift cards so that I could order food while Dan was eating his hospital food, and we could keep our nourishment. Hospital food is just as difficult as it is still made out to be, unfortunately. However, we try to do we can with what we have, knowing that soon, very soon, as soon as possible, you'll be able to get your loved one back home and start feeding them the nourishing, homemade, whole food ingredients that you love to provide, right? And get them away from that mass-produced, usually white bread, starch-heavy hospital diet that is available when they are on site there. So coming out of this surgery and recovery then, knowing what to expect, how many days we expected him to be in there, we were able to set up the house to be accessible to him so it's easy for him to get around. Staying in the tube was something that I was unaware of, but any other heart surgery patient knows you have to protect this healing incision and surgical access through the sternum by keeping your arms in close. And so we modified the home as we needed to make it safe for Dan. And now he's into his post-op visits and cardiac rehab therapy to help build the strength and to monitor his progress to make sure he's hitting those benchmarks, to find that right balance of gentle, progressive growth without taking on too much too soon, which certainly as your heart is healing, you need to be very, very cautious of. So while it, again, can be very difficult to throw your entire schedule up in the air, to go from back to business as usual to taking as much time as everything needs to take, I think it's essential to recognize and to appreciate, to try to make peace with as best you can, that the body needs what time it requires to heal. When we try to rush these processes and get back to business as usual too soon, that stress on the body can most often lead you to a longer recovery. It's going to leave you sidelined longer later than if you just find the way to make peace with the process and to give yourself the time that you need to heal as soon as possible. One of the greatest changes that I have seen in his recovery is the amount of sleep that his body is requiring. Sleep is healing. Rest is healing. The fact that he can now comfortably rest again in bed is wonderful to see. And as the weeks go by, his body is demanding less of that sleep. So that's how I can tell that his body is healing, his vitality is returning, his energy is returning. Now it's getting more difficult for me to keep him from diving back into the activities that he typically enjoys. So we're still taking our time and monitoring the progress and working closely with his team as we make our way through these benchmarks. I want to share too some of the indicators because I was unaware. As somebody who has worked in health, who has a really clear idea of how stress affects the body and what to look at, I really felt like my eyes were not on the ball when this entire situation came to pass. So, aortic aneurysms are not terribly common. And so it's important to know what the symptoms are of these. And with my husband, his primary symptom was pulmonary edema, which again is not something that I'm familiar with. So I'm going to take a few moments and share the signs of these two situations. So first of all, pulmonary edema can have other causes, but most often arises from situations with the heart. As I mentioned, the rupture in his aorta had the pressure going wrong in his heart. And so that extra demand in his heart was causing stress in his lungs. So that suffocative cough that I explained is definitely a sign of pulmonary edema. Anyone experiencing shortness of breath, especially if it begins suddenly, feeling of suffocating, sometimes with the breathing, a bubbly wheezing or gasping sound, coughing up phlegm that has any appearance of bloody look to it, difficulty breathing with sweating, the skin taking on a bluish or gray tone, confusion, and sudden unexplained weight gain. This is the sign that we missed that I wish I had been aware of. My husband keeps an eye on his weight, and he actually noticed on the day that he fell ill that he had gained about 10 pounds. And I'm aware of edema, and I'm looking at him. He looks to be pretty consistent with his typical physical condition for me. And I ask, are your legs swollen? Because that's where I'm aware of edema influencing us. Often when the body is not able to call back in the fluid that leaves the vessels, right? From the vessels and the capillaries, plasma leaks out into the tissues to nourish the tissues and collect waste. That interstitial fluid then is collected by our lymphatic system, which is also an essential part of our immune system. That additional weight gain wasn't evidenced by edema in his legs, but now we understand. That was fluid that was causing pressure in his lungs. That was the greatest physical risk. Certainly at that moment in time, the heart over an extended period of time would not have been able to sustain that additional load. But that was what we missed about his pulmonary edema and why it took us a couple of days for him to get in and be checked. Now, signs of an aortic aneurysm, which is an inflation, a widening in the aorta, which arises from the heart, and then the part of the aorta descends down through your abdomen. So sometimes an aortic aneurysm, most often, will take place in your abdomen, sometimes takes place up in your chest cavity, in closer to your heart. So signs that this expansion or pre-rupture phase of an aortic aneurysm can be high blood pressure, plaque buildup in your arteries. These are signs of heart disease that are typically found through scans. Again, Dan didn't have any of these signs. High cholesterol, inflammation in your aorta, which can be hard to see. We don't have that magic lens, do we? Can come on after a traumatic injury, like a car crash or a fall or an untreated infection. In the hospital, they were asking him about possible sources of bacterial infection, dental work, any work on or around the spine, or that sort of thing, travel, which we, outside of traveling here within the States, we didn't have any foreign travel to explain what had come on. And then following that rupture, so if an aortic aneurysm ruptures, then signs that you're going to notice could be pain in the neck, jaw, chest, abdomen, lower area, the buttocks, the groin, or the legs, trouble breathing or swallowing, shortness of breath, coughing, again, many of these symptoms of pulmonary edema, feeling of fullness in your stomach, or throbbing sensation near your navel, right? Because that descending aorta goes next to and behind your digestive organs. At the point at which it has ruptured, you may then take on the additional symptoms of pale and sweaty skin, a faint pulse, because the aorta carries that high pressure blood from your heart to send it through the arteries to the rest of your body. So when your aorta is not successfully carrying that blood anymore, then all of your tissues are going to not be getting the blood that they need to be sustained. So that's why suddenly you would notice your pulse would be changing, your heartbeat would increase, again, trying to get that blood moving, dizziness, numbness or tingling in the arms or legs, nausea, and sudden pain in your neck, chest, back, or abdomen. Heart attack pain tends to come on a little more slowly, mild discomfort that then gets more extreme, but an aortic aneurysm tends to come on as very intense, fast onset pain. Could be described as ripping, stabbing, or feeling of tearing. Now, Dan didn't have any of these symptoms because, as I said, it was in a very unique place in which that ruptured aneurysm was captured within his heart. And that's part of what made us so stinking lucky through this entire experience. The cardiac team was actually pretty fascinated by Dan's case. It was a pretty exceptional case. And so maybe that helped us along the way to be a bit of a curiosity. I think he took it pretty well, all told. So I want to share those as just warning signs, as indicators, so that we're aware, right? You know, we tend to know the warning signs of heart attack, the warning signs of stroke. I just think it's important that we are also aware that there are some things that are the exception that can come up pretty suddenly and have a pretty profound impact. So those are some warning signs, symptoms for pulmonary edema, for aortic aneurysm, and even those who don't have cardiac disease can be subject to having an experience like this at, we still think, the relatively young age of 60. So with all of that as point of reference for you, I want to encourage you again to listen to my conversation with Audrey Weidman, who has, following her heart attack experience, really poured her focus and her mission into educating people of the impact of stress, the way that stress can drive cardiac disease and can cause heart attack even in people who don't have any other signs of cardiac disease. Happy Heart Health Awareness Month. In all of the amazing and extraordinary abilities of this muscle in our chest, of the heart, the way that it drives every other system, all of that we maintain in our miraculous bodies are so intertwined. And when any of the systems are out of balance, it puts demand on the others. And so I encourage you to envision this beautiful symphony of systems as something where, as the more in tune you are into your body, into the way you feel when you are healthy and well, what thriving feels like for you, the more you can be aware of imbalance when it affects your system, the more you can advocate for yourself and look for the solutions before something really dramatic takes place, right? We want to stay ahead of the curve. We want to minimize recovery whenever and however possible by hoping to minimize and moderate these situations as they come up, because they will. There's a lot of systems working in tandem, and it's natural for things to come out of balance. So with your awareness and your mindfulness in your physical and emotional, mental well-being, then you will be better prepared to meet them and to bring yourself back into balance as soon as possible. So thank you for listening to today's special little message. I appreciate you being here, for the time that you take to listen to these episodes, to share this with someone who, as I mentioned, might have cardiac issues or might not, because this is the kind of thing that comes out of the blue, lands on you, and really teaches you what's important in life. And what I know is important in life is the vitality, the health, and the happiness of the people that you love and yourself. And you can't take care of the people that you love if you're pouring from an empty cup. So until next time, I encourage you to take good care of yourself, to do what you need to do to nourish your soul, to feel like you're thriving even in these wildly chaotic times. I'm always sharing information and episodes all through the matters of stress, well-being, holistic health. You can search episodes by topic on happifiedlife.com. So check out other topics there if this whets your appetite. And I hope you'll leave a review, leave a comment wherever you found this episode on your favorite podcast platform or YouTube video. Or if you're in Facebook, I'd love to see you inside my Live with Less Stress Facebook group where we continue the conversation. Thank you again, and I look forward to seeing you soon.
Thanks for listening. You'll find all the resources we discussed today online at happifiedlife.com, along with links to subscribe to Happified on your favorite player and a handy search tool so you can search all of our previous episodes. Help us grow by leaving a quick review and share this episode with a friend. Until next time, keep on shining.